we ready, Holly?
We are ready.
Okay, all right, so good afternoon. Thank you all so very much for coming back. We appreciate the opportunity to have some additional conversations with you all this afternoon. And thanks again for your team members that came back with you to be a part of this conversation. So thank you so very much. We do have a few questions, just a few questions for you here this afternoon. I am going to start with Mr. Neil Skeen, who is one of our members, and he has a very specific question to you about ACEs. So Neil.
I believe this was sent to you. You have it. So I'll just read it for the record. How would you evaluate the prevalence and importance of adverse childhood experiences, their impact on children's needs, and the value of integrating trauma-responsive services in the programs for children? And if you would briefly describe your experience in making this analysis and your willingness to include that in this project.
Sure. So, team, I will take this, but Jody, can you hear me?
It's very faint. Like I heard the question. It was one of the questions that was sent around adverse childhood experience, but it's kind of hard to hear.
Okay. I will talk. Hopefully, you can hear me now, Jody. I might take it over to her to add a little bit more to it. So, maybe kind of to first start in thinking about how we would approach something like that. So we do have an entire evaluation team at PCG. So we have worked kind of in this particular area for kind of a bit. I think when you think about evaluation, you want to really figure out kind of who your target population is, right? And who you want to study and kind of what those questions are that you want to look at. Some of the work that we're doing right now in Missouri is for what they call a QRTP assessment. So part of that Family First Prevention Services Act that was just passed that went active a few days ago on 10/1. One of the requirements is like looking for, because we know children do not have good outcomes if they're placed in residential facilities when they do not need a higher level need of service, for example. So what states are trying to do now is trying to figure out, okay, how do I figure out kind of what, for kids who are already in foster care, so these are kids that are already kind of in the system, how do we make sure that we're kind of giving them kind of the best kind of a home for them to kind of really thrive during this period of their life? So we do an entire assessment in Missouri where we're looking with their residential providers and looking at their trauma-informed models. So part of our overall approach would be kind of like, one is identifying that population. What are the questions and pieces of information we're really trying to get? Look at the different trauma-informed approaches. There's lots of different models. Kind of what makes sense. Again, depending on kind of what that population looks like. Really utilizing folks on our evaluation team who have done evaluations on evidence-based practices. One example is in Maine, where they did a multi-year study on what's the Maine Enhanced Parenting Program, and also in West Virginia, the Safe at Home at West Virginia. So really kind of looking at kind of children and youth who have substance needs and mental health needs, and kind of making sure that the right framework is in place. And Jody, can you hear me?
Yep, I can now.
Okay. If you want to add on, because I know you've also are being trained in some of the trauma-informed approaches too.
Sure. Yeah. Many of our team members come from direct service background practice. For example, I have direct service background practice in early intervention and case management. And so many of us have been trained in trauma-informed practice models and bring that to our approach and work. And we come to you as a national firm as well. And we have partners, national partners that we work with, such as the National Children's Traumatic Stress Network and colleagues at the Center for Youth Wellness, and have worked to support many of the ACEs tools that have been adapted from that original study back a while back by Vincent Folletti and colleagues, to look at using kind of the ACEs study and approaches and different tools that have been developed in prevention and intervention work. So We would build on our partnerships that we have with other national entities and organizations, and we're quite familiar with a lot of those tools that have been used in primary pediatrics, such as programs like Healthy Steps and other programs that service young children and families, and use those tools in collaboration with our evaluation team.
Okay, thank you.
We can figure it out. Okay. All right, I'm having technical difficulties here.
The light's not coming on.
No, did the battery die?
The battery might have died.
I talk too much.
Let me see if I can go find a new one. It's
Okay.
still
We got
dead.
the other
We will
person.
project.
Oh,
She's
she's
made,
back,
yeah,
sorry.
she's using,
I
okay,
might just need to project.
Yeah.
The microphone's in the computer.
no worries,
Lower
okay.
that, lower that.
I will lower my mask. All right, thank you all. Thank you very much for that response. We do have another question. Walter, I'm gonna pitch it over to you so you can ask a few questions.
I've got 2 and/or 3, so we'll start with the first one. In your prior experience, in your reply, you listed that you, quote, created, developed, and managed an ASO for Hillsborough County. And then you referenced the CSC column in the Children's Board of Hillsborough County. I think those 2 references are aligned. In other words, the ASO was the Children's Board. Did any of that work include conducting a needs assessment for the Children's Board, or use an existing needs assessment to establish funding priorities for the Children's Board?
So thank you for the question. And I am familiar somewhat with the ASO development that PCG did. And that operation was developed through our PPL partnership. And so I don't know all of the complete background. It was many years ago as far as what type of evaluation was done on the very front end of that. I do know that our PPL subsidiary was, completely instrumental in putting the ASO together. We ran it for many, many years. We actually staffed it at Hillsborough County with a PPL employee, and then eventually that employee became an employee at the Children's Board. And I believe that person is still there running the ASO.
So today's infrastructure at PCG isn't requisite with that knowledge. That was someone who was part of the corporation that's no longer part of the corporation.
Yes.
Gotcha.
Yes.
However,
our PPL division still performs the same type of work around the country.
Gotcha. So second, this is a different angle. Your selection of SWS appears to be strongly supported by their experience in conducting collective impact model in Cumberland County. Their work and history appears to be largely informed by the child welfare population and does not include a larger population focus for the purpose of conducting a countywide needs assessment. So that is like all children. So what controls do you have in place to make sure that their involvement includes a broader scope, not just child welfare kids?
Sure, and Alan, I'll ask you to kind of jump into this as well. So, one of the examples that we put in there, the Cumberland project is very much focused in child welfare, but as I mentioned in some of the other work that we've done, both in Dutchess and also in Hamilton County, Ohio, it's looking at kids that have not yet come into this system, right? Because that's, I know, kind of the focus of the council, right? Like, how are you kind of providing services and supports before, kids kind of come into the system or are part of the system? So I think what we would want to do is, not only kind of work with Alan and the rest of our team that has kind of some vast experience, but I think this is also where we want to make sure that we're kind of engaging with you in the community. To make sure that we're kind of encompassing and knowing kind of who we should be pulling into as kind of part of our team and part of our discussions around kind of needs of all children. And I don't know, Alan, if you wanted to talk any more about your experience beyond child welfare. You were on mute, Alan.
It's good to unmute. Okay, thank you, Beth. Yes, first, in reference to the work in North Carolina in child welfare, it's in the 3rd and 4th largest counties in the state of North Carolina. And even though our focus is a hybrid collective impact model there, in both counties, we had many focus groups and stakeholder meetings as a primary start of our scope of work to figure out how we really want to approach and develop a framework for the work we wanted to do in each county. So in that regard, we met with the school system, juvenile justice, judges, attorneys, guardian ad litem, community organizations. There are a lot of organizations and community groups and providers who intersect with an agency like DSS. And in each instance, in both of those large counties, we had to I met everyone in the community, from the commissioners, the mayor, everyone, to really get solidarity and support for the work we're doing. Prior to my ownership of my current company, Southeastern Workforce Strategy, I owned a company named Family Financial Literacy, and Family Financial Literacy LLC, and we provided work, job skills, soft skills, and financial literacy skills. And we had a state contract, and we served. South Carolina has 46 counties, and we served over 30 of those counties over a 9-10-year period. We were the largest provider of that service in the state of South Carolina, and we had a very productive private-public partnership as well. So in that instance, it was getting to know a lot of communities over our fine state of South Carolina, getting to intersect with a lot of people who were players in those communities as well when it came to getting people employed, getting support for our program, getting interviews for folks who were looking for employment. So my experience kind of runs the gamut.
Thank you. And to add on to that, because you mentioned connecting with local providers, local entities, and using sort of the CSC as an engagement support for that. I believe we're following this up with a final offer from them. So you can put it specifically in your final offer, but I want to hear a little bit about what is the level of engagement that you're actually thinking about from the CSC Leon, and is it with the entire board as far as engagement with local providers, or is it through the executive director? Is it through support? Is it a few phone calls, or send me your list, or is it I need you to host meetings and we'll be there? I can't quite gauge the level of involvement you want from the CSC.
Sure. So I think what we would, all of the above. But so the way kind of been thinking about this, just as we were standing outside, I think what we would want is from the executive board to really be kind of part of the governance structure, right? Kind of who are the decision makers kind of on your team that we need to kind of make sure that we're presenting you with it, like who's signing up on the deliverables, who do we need probably in those kind of status meeting type check-ins to make sure that we're on track. So I kind of see it at a couple of different levels. So we would probably want some sort of the executive leadership to be part of what we would call that governance board, and to be available for kind of status check-ins, deliverable approval, and just kind of giving the green light on things, kind of the key decision makers kind of on your side. Then I think what we would want is, in terms of like the broader board, is kind of thinking about how do we take the broader board, and even thinking about people who might not be on the board, but who would be very much involved with the CSC, other kind of community leaders, and kind of create what we would call like an advisory board of sorts in terms of the structure. So probably wanting to meet a handful of times, just to kind of, as we're starting to get into developing the questions, like who should we be reaching out to, kind of looking to that group to really help us identify who, like where should we meet, how should we meet. Like we can certainly set up meetings and do all of that, but we would really need that larger advisory board kind of built off of kind of your team and possibly others from the community that might not currently be part of the board, but are kind of key members that we would want to engage, and probably have at least monthly meetings just to kind of, and it might be a little bit more frequently in the beginning as we're just trying to kind of get our feet wet and try to start to kind of identify questions and surveys and groups and, all of that, and then kind of have more of a monthly type kind of cadence kind of throughout the lifespan of the project.
Thank you. And then this is sort of an add-on to that. That's my last question. I think you introduced yourself as someone who's going to kind of manage the contract deliverables and make sure sort of the quality is there and everything. I have a fairly large contracting background in the state of Florida, and in training contract managers, I always talk about that initial post-award meeting and how critically important it is that everybody's sort of on the same page and that you have a row ducks in a row kind of discussion about deliverables and timelines and everything. I think we have that built in with a governance document deliverable pretty early in the process. You also talk in your proposal about having leadership meetings with the board, individual leadership meetings. Could you talk about the difference between an individually based leadership meeting and maybe what I could call a visioning session with the whole board, so you would get unified input versus 10 different potential inputs?
Sure. Yeah, so I think the intention of the one-on-one, the interviews, kind of the one-on-one interviews is, I think, kind of first and foremost during kind of our frame-up session, which is where we have that kickoff meeting where, we have like, here's what we agreed to in the contract, here's the work plan, and now let's kind of get down to brass tacks. And that's really where we kind of get into like, let's get on the same page and make sure that we are aligned, not both just on paper, but in presence. And then, kind of what we also found to be helpful in other engagements was then just to have, okay, so we want to hear from the larger group, but we also want to hear from key individuals one-on-one, especially when they talk about kind of like, what are the needs? Kind of where do you see the needs in your community? And kind of how do we make sure we're starting to kind of capture that as we're kind of documenting both that current state, but also that kind of visioning kind of future state. So that's the intention of those one-on-one conversations, is to kind of, we heard you in these larger group meetings, but sometimes it's when you get somebody one-on-one, you can have a little bit more of an open and honest conversation. So wanting to kind of use that time with kind of key members of the leadership here to do that. I think what we would also want to do what we had put in the initial proposal was just about kind of the CSC leadership, but in kind of thinking about kind of how we get to the neighborhood level and kind of what has been more effective in other engagements, I think we would probably want to have those one-on-one conversations too with folks that we would want to kind of include in kind of that advisory board type setting. So I think we would always want to have, a good group conversation, but we also don't want to have too much groupthink. So we also want to make sure that we're having those individual conversations with key people that you can help us identify.
And sometimes those individual conversations could be a group of 2 people. I mean, we would definitely work with the team, the leadership team, to identify, what would make the most sense and work for everybody, best.
Thank you for that. And following up in your analysis about engagement with the community and various groups, I'm just interested if you can just briefly tell us how in the past, based on other contracts that you've had, how you would envision engaging the youth. I was real impressed this morning by the various groups. And one of the groups was meeting with the youth, determining or listening to them about what their needs are. So will you just explain your history of doing that and how you would propose to do that under this particular proposal?
Sure. So I think, at the end of the day, we always want to make sure that we hear from the youth, since that is a lot of, not just for their families, but there's a lot of focus on kind of what they need. And what we've done in different ways was, first and foremost, we would kind of tag on to different kind of organizations, like the Boys and Girls Club, for example, kind of different organizations in the community, where you had kind of really active kind of teens, really probably talk mostly kind of like to the teenage population, to really kind of understand, like, what is important to you. And a lot of times things align, but we also found out that not always do things align. A lot of times, in this particular case, a youth is like, they're looking for a place that's safe to hang out. They're looking for a place that's, where they, have some quiet when they can study. They don't know anything about PCIT and FFT, like all these like evidence-based programs, like they're looking for sometimes really kind of just some more simplistic types of needs. So we would first and foremost, we went out to those different groups and then we went into the schools. So we actually had, working with our kind of county partners, this was in Dutchess, we actually like targeted a couple different school districts. There's a lot of, large and small kind of urban and rural school districts in Dutchess. So we knew we couldn't do all of them. So we kind of tried to do like a kind of a sample of kind of each kind of size, especially in rural and urban, because again, those needs are very different. And did a lot of after school programming to like just ask the questions, like, we did things in terms of trying to make it more interactive instead of like just here's a survey. We would give them some questions and then we used art. So we had the art community in Dutchess kind of really be a partner with us, and we did like a poster contest. Like, how do you really engage kids? Very different than how you engage adults, right? Adults were like, sure, we'll take a survey, we'll have a one-on-one conversation. The kids tend to be a little bit more expressive. So we kind of partnered with the arts community and we kind of, worked on a poster contest. We like went into the school themselves, we went into the community centers, we kind of went to where they were to kind of get their feedback. And because this was like a very pronounced county initiative, part of our contract for that project was to set up this youth forum. So we had a whole part of the contract where they wanted us to then organize an all-day event, where we then kind of, a lot of the, kind of the kids in the community that tend to be more active kids in the community kind of participated and kind of in a, kind of almost like a student government type structure to really kind of have their voices heard. So I think we could kind of employ some of those techniques kind of here in Leon County, where we're really, I think, number one, we need to kind of go where the kids are, and then you need to kind of think about how you're asking the question, because it's always, I think it was very eye-opening, where, especially where it just doesn't align sometimes.
I do have a question for you that I thought about as I was reading your proposal. And I just want to have a quick conversation with you about it. You said that for your data review, you plan to look at statutes, regulations, and policies that govern children and youth services in Leon County. I'm sorry, can you hear me? Do I need to repeat any of that?
I could hear you.
Okay, all right, I'll just say, in your data review, you plan to look at statutes, regulations, and policies that govern children and youth services in Leon County. Have you ever looked at or thought about evaluating upstream policies? So not policies that directly impact children, but policies that have a ripple impact on children. So for example, there are policies that are specific, like preschool lunch, that's a policy that directly impacts children. But there are often policies that are at the national level or the state level that ripple down and really have an impact on the lives of those children. As you review data and as you look at policies that impact, what are your plans and how do you look at upstream policies that do have a significant impact on the lives of well-being of children?
I will start this, but I might kind of kick this over to Jody, Casey, and Alan and others. So I think, 100%, I think, one of the things that we've done in some of our other projects, because even though you have, exactly to your point, you might have certain local policies, town, city policies and ordinances, but at the end of the day, a lot of things do trickle down, especially at the state level and at the national level. So I think what we would want to do, especially when you look at kind of the tenets that you've laid out, your priority areas, exactly to your point, a lot of that, there's a lot of kind of higher up infiltration that we would want to look at, especially when you think of school readiness, right? So kind of what are the standards not only in the county and in certain communities and certain districts, but what is it in the state of Florida? What is it with all of this federal policy that's kind of looming in Congress right now? Like, how is that going to affect? I think it's a very interesting time to kind of think about these kinds of needs and policies right now, where there could be a big change coming potentially to see kind of what happens at a federal level that will trickle down, that we would want to make sure that we're kind of taking advantage of, both on the policy side, the funding side, which is always key. And I think, and just also just like learning from part of our kind of literature review of best practices of like, you know, kind of what has worked in similar types of communities. Again, knowing not one size fits all, but I think there's lessons learned there. And I don't know if Jody or Casey or Alan have anything else to add to that.
I'm going to pause and see, Casey, since you're on the phone, before I jump in, I wanted to make sure that if you have a chance to say anything, if you want to.
Yeah, thanks, Jody, but you can go
Sure.
ahead.
Oh, okay. Yeah, so it's such a great question. Thank you for asking that question. We all come to you with kind of a cross, hopefully you're able to see the cross kind of backgrounds, early childhood, child welfare, data, fiscal, and very much connected to federal policy that's happening. It's very important for us as a company to be a part of those federal conversations, because we really see ourselves as advocates for our clients at, you know, community, state, federal areas, that we can be cheerleaders and also support systems for helping understand what's going on from a federal and state place, so that there can be that connection. And as you said, that ripple down effect. And so we definitely hope to bring that lens to, if we have an opportunity for this work, but that we do bring that to all of our engagements in terms of sharing and learning together.
Thank you. Thank you for your response. Thank you. Let me just check in with my members. Are there any other questions for you? Okay. So that concludes our questions for right now. So let me just tell you, we are at the end of our day. You've had a long day. We are not going to have a final round of questions for anybody. So you all are welcome to go home. Thank you so very much for this. But I do want to let you know what to expect and what will be happening over the next couple of days. Okay. This team that you see here in front of you will be convening tomorrow. And what we're going to do is we're going to review the negotiations and our notes from our conversations with you all today. And we're going to go back and we're going to draft a contract to solicit your best and final offer, okay? That draft contract, together with any separate documentations that of anything that we want or we're going to request for you to add as an amendment to your response, will be emailed to you no later than 12 noon tomorrow. So be looking for an email from Holly tomorrow by 12 noon, and we're going to say, you know, this is what we would like to see included in your best and final offer. And we'll also have that contract as a part of that email. Now, we're asking you to look at that contract. We're asking you to look at the recommendations that we have or the request for amendments. And we're asking you to make any changes to those documents and track changes, because we wanted to jump right out at us at exactly what it is that you're adding to those two documents. And we're asking you to also sign the contract that we send to you all, okay? And return that to us. And we would love to receive that no later than Thursday at 12 noon. So please circle that, highlight it, bold it. We're going to be looking for that on Thursday at 12 noon. After we receive your best and final offer with your track changes and everything, our team will then convene on Thursday afternoon. And this will be an open meeting. And during that open meeting, we will have a discussion with this group and we will make a recommendation as to who we want to take forward to the council to complete the assets and needs assessment for Leon County. You will then be notified from Holly on that evening as to, you know, who we want to take forward. Now, what we will do is we will take that recommendation, we will take it to the board, to the council on October the 21st, and then the council is expected to vote yay or nay on the 21st. So you will know something definitively on the evening of October 21st, okay? That's the process. Do you have any questions? Do I need to repeat any of this?
I do have one question.
Sure.
In terms of the signature, can it be electronic or does it need to be wet?
Fred?
It can be
Electronic, that's what I thought. Before I answer that, I wanted to make sure the attorney said yes.
Yeah.
We will likely, once we have it all, we'll like initiate with the certified signature.
Okay. there. Yeah, for ease of just timing, that would be, yep. Easier. Okay. Does anybody else on the phone have any questions about what they heard? Casey, I know, did you have any questions?
No, I did not have any. Thank you.
So, I don't know if Mr. Attorney, you wanted to go over the one attachment. I'm gonna send it to them, but.
Yeah, yes. So one of the things you will get electronically, I'll just give you a hard copy to make it easy too, is this will be added, and the purpose of this, and there's a lot there, is to sort of commit to your key staff. So when it comes, when what you send back, this exhibit 2, your project plan, that will be in the form of essentially what's currently part D of your proposal. Yeah, tab D, which is your service description.
Yep.
So we're asking you to send that back to us, and that should include a project organizational chart, much like was in the slides that you gave us today. So we just want to make sure we see that, and then it'll be no more onerous than this, and make it a little bit skinnier. But this will be language added just to make sure we can commit that these are the folks that are going to be dedicated to the project and the consequences if they're not. So that's something that you will see in what you get tomorrow. Yep.
Okay, well, that concludes our meeting today. Thank you all so very much for your time. We appreciate it. And thanks to those of you who dialed in and for being a part of the conversation. Thanks again. All right.
Thank you. Nice to meet you.
Thank you.
Thank you, everybody.
Appreciate it.
Thank you.
It's good being here. Thank you thank you so much for inviting us. Very much. Yeah, I'll let you know how this thing goes at minimum.
All right. Okay, so we have that now.
You'll explain that.
Is it not?
Is this, can you hear me? So the meeting is still being recorded.
Okay.
And in case anyone has any discussions,
Is the meeting in the morning at 9?
the meeting is from 9 to 11 tomorrow, I believe.
It is on Phillips Road, the Turpin and Fountains is what I've got.
Yes, the sub-office, the regional office.
2383 Phillips Road.
Yeah, I've got it. Okay. At 9 o'clock, we should.
Yes, ma'am.
Okay.
We'll have somebody at the front door let you in.
Thank you. Thank you.
Turn off the mic.
All right.
Thank you all.
Do you guys have,
Great job.
when you guys got the mic?
It's right here. It's right here.
They do not.
Thank you.
Thanks.
Is that what your office is? On Phillips Road?
So you don't have to travel anywhere.
Okay.
Okay. 10 minutes from my home with no traffic.
Even better.
So where? No, it's not. Yes, so it's right now. They just figured it out.
How is it building?
So it's on
Hey, you guys clean that table off, y'all.
Between now and 9 o'clock, just be thinking about if there's anything that you think must be in the contract, because when we send that to them tomorrow, that's what we're asking to sign and send back. So if you have any other thing I handed out, which is maybe a little bit more key than needs to be, like on the key staff, we could skinny that down a little bit, or if there's anything else you see that they said that we want to make sure we see, we gotta get it in tomorrow, if it's in our part. And, the statement of work is still exhibit 1 of the call project requirements. The front end will be the same, and then when they send back to us their project plan, that's the contract that you're gonna go to the council, and so we can, this is the best deal. So those are the
If we get something from them that we don't like, but we still like them, we have a chance to send it back.
Yeah, The very, very short answer is yes, there's always a way for a request for revised final replies. To me, that's horrible practice.
Sure.
Like a final offer should be the final offer,
Right.
and we gave enough coaching. and
But if we
guidance.
wanted to add more specificity to what they give us, it's not specific enough.
Time-wise,
in
it's
other
best to
words,
do that tomorrow, because if we want October
But we
21st.
won't have their final proposals tomorrow.
I know, but we send it out to them tomorrow, and they hit the October 21st deadline, we need a decision, and we need to reduce the writing and explain on Thursday. We
Otherwise,
got no slack in the schedule.
otherwise the process for, not complaints, for, what is it?
Well, that's-
For protests, will
yeah.
go beyond the 21st.
Well, and also the amount of time between your recommendation and the next council meeting, we miss Thursday, this is
Yeah, we
until
did.
a month.
But I mean,
But I mean,
let's-
we don't
let's-
have, we can only get, I'm sorry, but we can't get them 24 hours, like, let's say they do make edits
It's,
to their,
we literally,
we
it's,
can't.
we.
And the judge can call an emergency meeting of the board. That always can happen. I mean, we don't have to wait until December.
We're supposed to.
Get it done in October, but you don't have to wait till November 21st.
You try to get all the little best friends to scoop out of there, you're licking your fingers.
Exactly. Respecting my, trying out the inside of the mouth.
My daughter likes to play like that.
This does not have soup in it. This is a drink. No soup.
Starting the
Yeah.
I'm about to grab.
So Brad,
It's better not to.
I think you know that, Brett. It'll be great.
Thank you, sir.
I guess we'll see you tomorrow.
Look forward to seeing you tomorrow.
We don't want to share that, so.
Make those saying that we understand this, and we understand.
All right, here.
I'm gonna take a mystery soon.
Take that, fix something.
Anybody else want the last two? All
Hey, I'll take it.
right, I'll see you later.
We negotiated, yeah, we negotiated. There's nothing written.
I think I got the bread.
There's
You
nothing written.
have the bread? Okay, then I'll grab that.
Yeah, and I do think a lot of those people we got during the project.
That's what it was.
Yeah.
You want some silverware? We got enough for 20 people. No, it's gonna be great. Is that too much for your
Yes, I did, I mastered it, and my kids, especially the winter, my son, Mom, if I got my potatoes, will you please make this? It just takes so long, but it gets so really. I don't even know if it's the greatest.
You know what's really good at Restaurant is they do a bread bowl.
Oh, yeah, they do, they do.
That is so
Yeah, they
good.
do.
I mean, they do.
That's what it is, like,
Yeah,
I'll be doing this.